Hello, everybody. Welcome to today's Water Reclamation Masterclass. Today, we're going to talk about some of the issues that we're dealing with our municipal water supplies and how to get clean, life sustaining water into your home and to your family. And that's my intention today, is just simply to get you protected at this most basic and essential level. But we're also going to talk about one of the most miraculous things that I've seen in the last few years, and that is living water. And so here we go. Hope you can stick with me through the whole thing. And I promise you it will be interesting. You won't be bored. Before we dive in, I want to ground us on why we're here. Pretty much all of us already know America is in a water crisis, but most families genuinely have no idea what's coming out of our taps. Nobody's teaching it, not the schools, not the doctors, not the municipalities that deliver the water to us. So this class exists so that you can find clarity, find solutions, and gain control over that most essential resource in your home. Who am I? I'm John Campbell. I was an enterprise consultant for 40 years, 22 of those spent at Dell, helping design some of the largest enterprise systems in the world, and made enough money that I actually got a chance to retire early. When I did, I pursued my first love, which was writing, and I have 10 published books in the marketplace. Thoroughly enjoying that, and working on the last book in a series right now. Really expected to continue writing for the rest of my life, but a few years ago, I found a new passion called molecular hydrogen studies. It's a relatively new science. It's being called the miracle molecule by scientists who are studying it all over the world. And it was so fascinating that I eventually ended up at the Molecular Hydrogen Institute getting certified. Level one certification taught me so much about the science of molecular hydrogen and science in general that I took the level two certification and am anticipating level three when it comes out. I'm sure I'll be taking that as well. Most of us already know that clear water doesn't equal clean water. But the gap between what's looks safe and what actually is safe is much wider than you think. In the US, the EPA regulates around 90 contaminants in our drinking water. Well, altogether, there's 80,000 chemicals in use across the United States, some of them in widespread use. We know what about 1% of those will do to you. The rest of them have not been tested and or adequately evaluated. And so when they get into our water, it's almost certain that they're doing something to you, but nobody knows what. Bottom line, 90 contaminants checked means that we've got a system that checks the surface but doesn't actually go any deeper than that to protect your health. If you pay attention, you'll find that the agencies that were created to protect the public's health are clearly telling us what's going on and why. The CDC, the Centers for Disease Control, tell us that this year 7 million people will be affected by waterborne diseases. Of those, 120,000 will end up in the hospital, and it'll cost about $3 billion to take care of those people. And of those, over 6,000 will die because of pathogens that are in our water and in our municipal water supplies. Um, CDC tells us why. The fact is that the needs for water have changed, but we're dealing with plumbing that was created, and the plumbing systems that were created around the beginning of the century. I think 70% of the water supplies in the U.S. are 40 to 70 years old, and the complex water systems that the large commercial structures use nowadays are so complicated and use so much water, thousands of gallons a day, that there's no way for the piping system to handle them in a in a proper disinfected manner, and therefore biofilms are sliming our pipes, and pretty much every plumbing system out there that's feeding our homes has these waterborne diseases lining the pipes with this biofilm. And that those biofilms are actually responsible for the majority of the hospitalizations and the deaths that we're dealing with on a yearly basis here in the United States. Because I study water, Google sends me articles on what's going on with our water pretty much every day. Here's a couple that I got today, in fact, and they were both interesting. The first one is a large scale study that was published in Nature Microbiology, testing 1,076 compounds that are likely to be in our water and our food. And that test revealed that those chemicals suppress and rewire our gut bacteria with consequences for our microbiomes and our antimicrobial resistance, in effect, messing with our immune system. And that's the basis of our health. Dangerous for all human beings is all you can say to that. And that's just one study. The other one that came across my desk today is a heavily regulated weed killer that's banned in more than 70 countries, but still used here in the United States. And the farmers that have been using it and spraying their crops with it are now suing the manufacturer because an ungodly number of them are getting Parkinson's, and they're claiming that this nasty chemical that's on all of our food crops and in the runoff from those food crops, and therefore in our rivers and our reservoirs and ultimately in our municipal water systems where it's not regulated, are we now know that's causing Parkinson's. That's just so typical of what I'm finding as I dig deeper into what's actually going on in our water systems and what's being done to protect us. And so the numbers that these reporting agencies, not just the CDC, but the EWG, the USGS, and WHO, the World Health Organization, are reporting are, as I said, more than scary. There's independent testing that has found several hundred contaminants in our water system. Most of them we have no idea what they're doing to us. Uh, One good example of that is the PFAs that are in almost half of our tap water samples, which means they're probably affecting over 200 million Americans daily. And we don't really know what those PFAs do. Some testing has been done on that, but we do know that they're dangerous for our bodies, dangerous enough to be taken out of our cookware and out of our lives by manufacturers, and but not out of our water supply. The APA does recognize that this is an issue, and they are working to fix it. They say that they will have PFAS locked down in terms of figuring out what's going on with them in our water systems by the end of the decade. That doesn't mean fixed. That doesn't mean that it's all going to be handled and taken care of magically. It just means that they'll know what's going on and that the water systems, the municipal water supplies that feed us, are going to have to start protecting us from these PFAS in a few years. So it's fairly obvious that we shouldn't depend on the government to protect us. That we should take our health in our own hands and find safer alternatives for drinking water, which is basic to human life. Uh, and um, and so we look for those alternatives. One of the first things that stands out is bottled water. It's marketed as being very safe for us, but there's no regulation in that industry, so the marketing doesn't match the reality. It can say pretty much anything that it wants to, and it does. It's trying to sell you a product. The bottled water process uh, heats up the water before it gets into the bottle, which tends to break loose plastics. And so inside pretty much every bottle of water uh, brand, so every bottle of water by every manufacturer out there has these microplastics and nanoplastics in it. From the heating of the water, even from just putting on the cap and screwing on the cap, you get plastics in the water. Last testing done found about 240,000 pieces of nano and microplastics in a single liter of water. And I don't know about you, but I don't want to drink plastic. I want good, clean water. So, what are some of the other alternatives? You might think that, okay, I've got a filter in my fridge and that's going to protect me. Or I use the Brita water pitchers. That's going to protect me. But the truth is, basic charcoal solutions are really taste and odor filters. They don't get rid of heavy metals and some of the other contaminants that are in the water. In fact, most of the other contaminants that are in the water, I think they get rid of chlorine. Uh, but that's not everything that you're dealing with. It's just one thing. So those solutions, which are relatively cheap solutions, are also challenged because they are so cheap to actually filter the water properly. The water tends to channel through the carbon in those filters, creating its own little pathways through the water that ultimately defeat the purpose of the carbon in the first place. And now you're drinking unfiltered water again. There's only one system out there that is not active carbon, which we're going to talk about next. That's sort of the gold standard for filters. But there was one other system out there. It's called reverse osmosis. The Navy created it as a backup water system for their ships, not as the main water system, but as a backup. And you may have a reverse osmosis system in your house. The gotcha with that is that it takes everything out of the water. It's totally demineralized. All the healthy minerals that you need in water are gone. It's basically acidic, hungry water that can actually leach the minerals from your body. And of course, on top of that, most systems out there, especially the cheaper ones, are plastic, and they do tend to create molds and fungi in them that will affect your health and are challenging in their own right. In the big commercial systems that create reverse osmosis, not only are they really inefficient, I think you waste like 5 gallons of water for every gallon you create, but they also sit in containers that can become mold infested and bacteria infested before you get them bottled up and put into your house. So you buy the big plastic containers of water, and you think you've got a good solution because it's RO. Well, it's dead water feeding you, and a lot of times there's other things that you're dealing with because of where the water has been contained prior to getting it in that bottle into your house. So multi-pure. Uh, why are we recommending that to you? Well, first of all, it's using solid carbon block technology. It is the most effective filtration system out there that actually keeps the minerals in your water, keeps your water healthy, and able to take care of your body like it should. Um, but at the same time, it gets rid of the contaminants that other filters don't. If you look at the graph on this page, you're going to see that it's getting rid of more contaminants than any other filter out there. There's 1,000 of them on the market. But when it comes down to it, if you want to get rid of everything, you have to go with the active carbon block technology. Multipure is the granddaddy of those companies. They invented solid carbon block technology. They've been refining it for 50 years, and that's why they're so good at getting rid of it. Not only are they more effective, and the NSF is saying that, not marketing. So be very clear. If you want to know that something's actually working, look for the certifications by the major agencies out there look for the testing standards, look for those things. Don't pay attention to the marketing. The marketing is just trying to sell you something. Um, the fact that this filter does so well for you compared to anything else that's out there, there's a number of reasons for it, like stainless steel housing, which stops the molds and the bacterial growth. You replace the filter once a year, and you basically have clean water for decades, and that's something to be considered because it's bottled water is about $5 a day to consume if you're buying it in different stores and different buying it from Costco wherever, and that's a cost that never ends. Buy a multi-pure and it will work for you for decades because it's so well made and it's been around long enough to have proven itself and to have gained the reputation that it has as the best of the best. The other reason why we like multi-pure is because it pairs so perfectly with the Anagix Kangen K8, which is the other half of our water strategy. So the flow rates and the actual filtration and everything else that the multi-pure does uh, marries perfectly with this Kangen K8 that we're going to talk about now as we get into living water. So, what the heck is molecular hydrogen? Why am I so excited about it? And why should you care? Great questions that we're going to talk about in the second half of this presentation. And I hope you find this as fascinating as I have. So molecular hydrogen was not a big deal in the United States when I first looked at it, I think almost 5 years ago now. But my daughter came to me and said, "Look, I've got this new company that I've joined. It's called Enagic. It's been around for 50 years. It's got millions of users worldwide. And the water that these machines produce seems to be helping people. It seems to be, there's a lot of stories about how these machines are even curing cancer and doing things that were just extraordinary. Um, but she said, they don't know exactly why it works, or at least I don't know exactly why it works. And there's a lot of discussion out there about how these machines do what they do for people that makes such a difference in people's lives. So would you mind researching this for me? I know you're a techie. You can dig into this. And one of the first things that I looked at with these machines was the molecular hydrogen that they were producing. That was the thing that scientists were beginning to focus on. Back then, there was only maybe 50 studies out, mostly with lab rats or lab mice. But already the scientists were seeing reductions in tumors and cancers um, under in laboratory conditions that made them call this the resuscitation molecule. And the results of the studies and what it was doing for these mice was amazing enough for me to go ahead and buy a machine for myself. So I bought a K for myself, have used it for the last several years. I lost weight. I can walk the golf course now and enjoy myself. And I've been happy and healthy. If I get sick, I tend to be sick for a day or two, and get well again. And I expect most of that is because of the molecular hydrogen. But I really didn't think about it that much. I just started drinking the water and enjoyed the benefits of it. It wasn't until my daughter came to visit earlier this year, and the neighbor decided she was going to buy one of these machines that I thought, well, I better bone up on the science because I hadn't looked back at it. I needed to make sure that my neighbor was getting something that was good. And so I dug back into Google Scholar and PubMed and found that the number of studies had just exploded. It'd gone from maybe 100 studies at most to over 3,000 studies. Of those, at least 300 of them were human studies as well. And scientists had gone from calling it the resuscitation molecule to the miracle molecule. So why miracle molecule? I mean, the first research that they did were showing cancer going away and reductions in tumors and all of these incredible things. But as the research expanded dramatically around the world, they also found out that it was helping with all of these other things. 8 out of 10 major human diseases were affected by molecular hydrogen. They were showing this in the lab. So neuromuscular diseases, um, obesity. I know I lost weight when I started drinking it. Cardiovascular diseases, metabolic diseases, and of course the cancers, the neurodegenerative diseases, and all that, as well as anything that had to do with inflammation. And a lot of diseases have inflammation as a root cause of the disease. The molecule was helping with all of these things, and they were seeing it over and over and over again in the labs. After I got certified, I'm a writer, and I decided that I was going to help demystify this science, this relatively new science, for as many people as I could. So I started a page on Facebook called facebook.com/miracle molecule mentor, where I would take the science that was so complicated and so scientific jargon oriented and just put it into plain language. And so this Alzheimer's study that I'm showing you here is just one of the things that I published. I publish almost every day. I took that study apart. When I looked at everything, I felt like this one slide, this one graph was very indicative of the study and what it had done. So they took a bunch of mice, they took 3 control groups, one control group without Alzheimer's, one control group with Alzheimer's that they fed tap water to, and one control group with Alzheimer's that they fed hydrogen rich water to. They did this for 7 months, running them through this maze all the time. And at the end of 7 months, they ran them through the maze one last time. As you can see on the left side, the non-Alzheimer's group ran the maze just fine, went directly to the food. The control group that had been drinking tap water for that 7 months, their Alzheimer's was just horrible. It looks like a child's crayon scrawl going on there, and so they were lost until they finally just happened across the food, and that's that disease for you. The most interesting part of the slide is the far right graph that shows the group that was drinking hydrogen rich water during that 7 months. They had Alzheimer's. They still made one mistake and had to loop back, but their brains were in much better condition, just because their water had hydrogen in it, and they went almost right to the food. So molecular hydrogen was actually improving and helping people who had or helping mice who had the disease. That doesn't mean that it helps human beings that have the disease, because mice and human beings are 2 different species. But it was, they used mice for a reason in labs. It was very indicative. And since then, the human studies have been finding the same thing, that when it comes to a disease like Alzheimer's, that molecular hydrogen can cross the blood-brain barrier and actually take people with Alzheimer's and improve their condition. Molecular hydrogen is still in the test phase, but there's never been nearly as many studies of anything else as there has been with molecular hydrogen. And the things they're finding with the test subjects are 99.5% of them are pretty miraculous. If you dig into the studies in general, you're going to find that or at least I found that there's a lot of things that molecular hydrogen does to help with the aging process. It is absolutely able to be used to help prevent and treat various age-related diseases, and there's a reason why that is true. It's because molecular hydrogen has already been used by nature for millions of years to keep the body in balance by keeping the immune system healthy and balanced. It's something that the healthy diet and a young body produces naturally in relatively large amounts. I think it's 10 to 12 liters a day. And it helps regulate the balance of the intestinal flora and the metabolites in your body. And bottom line, it is uh, the key controller for immune homeostasis in humans, or the balance of the immune system in human beings, and pretty much all of the life on Earth too. Anything with with an immune system. So let's talk about that a little bit more. Immune homeostasis is the balance within the immune system that allows it to fight off the pathogens without causing excessive or harmful self damage. It's basically a dynamic equilibrium that your body has to achieve to be able to activate the immune responses against threats and yet suppress them from taking over, going crazy in your body, and starting to damage your body. And because the things that protect you can hurt you just as well. That balance is what health is all about. As I mentioned, relatively new science for human beings, but it's something that nature has been using for millions of years for all of life. And the science is really just discovering what nature already knows. Uh, the ability of this singular molecule to affect the human body in so many complex and powerful ways is really the result of evolution. Molecular hydrogen keeps our immune system strong and balanced when we are young. And when we supplement an aging system with molecular hydrogen, evolution has already taught our bodies what to do with that molecular hydrogen, and it's shown to be very effective to supplement the body with molecular hydrogen to actually de-age the body and to get rid of some of these things that are age related. Think about when you're young, you don't get cancers typically. It's not to say you never do. You don't get tumors typically. You most of us can expect a healthy life if we're exercising and have a relatively balanced diet. We can expect to be healthy for decades. It's when we start aging that the systems start having issues, and the molecular hydrogen can actually do things like like lengthen the telomeres, which are a key indication of aging, and uh, they show this in the laboratory studies that when you inject molecular hydrogen into a body in therapeutic doses, that you actually helped de-age the systems in your body. They found a lot of things in what is a 15-year-old science, and one of the things that they found is exactly how molecular hydrogen affects the body in one particular way. The paper just got published this week in Redox Biology, and it is a clearly defined molecular target of molecular hydrogen that helps to understand how hydrogen exerts its therapeutic effects. It is a mechanistic breakthrough that matches up to the original 2007 to 2009 studies that were first catalyzing interest in H2. And here's what it comes down to: the mitochondria are the body's powerhouses. Um, they regulate our cells' lives and the energy that they produce. This study showed exactly how H2 helps restore and improve mitochondrial function to make that organism stronger, healthier, and more resilient. I have What it came down to is they found that molecular hydrogen would stress the mitochondria of the body, but in a very limited way, in a way that actually caused it to activate its defenses, which then came back and made the mitochondria stronger and healthier and affect younger. But but it didn't do enough to hurt it. It would stop before it would start to really hurt the mitochondria and give it a chance to recover, very much like what a regular health, exercise regime will do for the human body, in that it comes in and tears the muscles down, but then it builds them back up. And as long as you don't go overboard with exercise, you build a healthy body by constantly tearing your muscles down and then giving them the chance to rebuild. And that's what molecular hydrogen is doing for your body's uh, energy powerhouse, the mitochondria.
Here in Tokyo with my friend and someone I respect very much, Tyler, who is the CEO and the founder of the Molecular Hydrogen Institute in Utah. And what's so interesting is I first met Tyler when I was there with Dr. Joe Mercola. And Dr. Mercola was obsessed with the work that you're doing and couldn't wait to introduce you to so many of his friends and different people. And I like to really focus on what Dr. Mercola does because he leads the trend. I mean, he is so passionate and so committed to wherever sort of the new research is really showing us to be focused. And you developed your Molecular Hydrogen Institute many years ago. Can you tell us a little bit about it?
Yeah, well, first I got involved in hydrogen back in 2009. I was just reading and studying, and I came across an article published in 2007 in Nature Medicine by Dr. Ota, who you just interviewed. And I was like, wow, this is really interesting. So I looked at all the research, all the studies. There wasn't a lot at that time, maybe 20, 30 articles, but it was very interesting. And then in 2013, I had the opportunity to go to Nagoya, here in Japan, and do an internship and research some of the molecular mechanisms of hydrogen and see with my own eyes that hydrogen gas really is exerting changes on a cellular level. And it was that time that I had the opportunity to meet Professor Ota. I went to his lab, and it was so great. We got there, and he got some wine glasses, and not wine, I don't drink, but he poured hydrogen water, and we sat around talking about this hydrogen molecule as we drank hydrogen water together and enjoyed such a wonderful conversation. And when I returned back home in 2013, I thought, I saw some amazing things. I believe in this research, that this needs to be out to the public. This hydrogen is really something that has the potential to help so many people, and I wanted to educate people. And at the time, nobody knew anything about hydrogen gas being beneficial or therapeutic, only that it was explosive. So I started a website. At the time, it was just a website called Molecular Hydrogen Institute, and I started educating people about the benefits of hydrogen. I put the studies on there. I wrote some articles. Then, as things started going forward, I started getting invited to go to speak at conferences, first in Beijing at a biomedical hydrogen symposium there, and things just kind of started escalating. And so now I formed the organization as a science-based nonprofit, and we're just focused on advancing the education, the research, and awareness. So I'm able to speak at various medical conferences throughout the U.S., go throughout Asia and Europe and speak at various conferences and collaborate with some of the best and top minds in the field of molecular hydrogen research. And I'm just very grateful to be part of this. It's so exciting.
Well, I'm so grateful, and we all are, for the work that you're doing, the pursuit that you personally have. I mean, for the past 9 years, right? From 2009, we're at the end of 2000.
Yeah, nearly 10 years now, right?
Nearly 10 years you've dedicated your life to it. What are the most interesting key benefits you've seen really in the past 6 months around hydrogen that you think will transform the way that people, our health in general? Like, what are the top keys?
Good question. I'd want to say that some of these new publications coming out on hydrogen being good for things like dementia, cognitive impairments, it's very powerful. I mean, there's really no drugs that have been shown to be effective for things like Alzheimer's disease. And so when we are seeing these clinical studies, not just animal studies, which were very impressive themselves, but actual human clinical studies showing that hydrogen gas can not only slow down or prevent the decline in cognitive impairments, but actually lead to improvements, to me that's amazing. And similar with stroke, cerebral infarction, this what's going on with the post-cardiac arrest syndrome. The Japanese government in 2016, back in November, approved the inhalation of hydrogen gas in advanced medicine so they could do a major clinical trial with over 360 patients in 20 different hospitals so they could determine the effects and benefits of hydrogen gas for this post-cardiac arrest syndrome. So I think this is really setting major changes in the medical community. But then just for people like you and me that are healthy, that want to live a better life, the research that's coming out on just exercise performance, whether it be improved recovery and endurance and exercise capacity. These are small things but are significant, especially for those who are really trying to get the cutting edge, right? Get some more energy, get yet another bout of exercise in to push themselves harder and to recover faster. And then also the fact that just drinking hydrogen water, everyone drinks water, right? So you can just drink hydrogen water, and in one of the studies with healthy patients, so they're not patients, healthy people, right? Healthy subjects, they drank the water and they had improvements in mood and anxiety and decreased stress, which to me is so great. We published a study in Scientific Reports showing that hydrogen could increase the resilience to acute and chronic stress in mice, and we exposed them to forced swimming and changing their make so they can't sleep at all, and changing their food, like a whole bunch of things to cause all this stress. And those that drank hydrogen water, well, they fared a lot better, had a lot more resilience to the stress reduction, and it can end up leading to rejuvenation of the mitochondria and activation of PGC1 alpha, UPRMT, the unfolded protein response of the mitochondria. There's so many benefits. Hydrogen, when everything's normal, but you need a little bit of additional hormetic stress, hydrogen alone can initially mildly induce reverse electron transport, increase superoxide production, followed by the reversal of that, but yet you're left with the changes in gene expression, such as PGC1 alpha, activation of NRF2, and all those other genes that lead to improved mitochondrial biogenesis and mitochondrial function, and now your mitochondria is working the correct way. So that's I think molecular hydrogen really is an interesting solution. This is not a strong drug
for reductive stress.
Yeah,
and thank you for explaining that.
Both reductive and oxidative stress.
Yeah, which means it's adaptogenic. It modulates whatever's dysfunctional and it makes it better with virtually no side effects. None. Zero that we know of. It's like the ultimate supplement.
Well, it's almost really like the side effects are potentially what mediate beneficial effects, right? Because a side effect is that it can, in some conditions, induce reverse electron transport or increase superoxide production. But it's only transient. And those transient increases end up activating our heat shock proteins and a lot of other benefits, NRF2 that I mentioned, and so on. So it's almost like, yes, there are toxic effects, but they're so mild and transient that those toxic effects end up being partly how the beneficial effects are mediated, the principle of hormesis. The leader, and that has been shown to have therapeutic effects in the body.
Such as?
Okay, so first the primary benefits. It has unique and selective antioxidant effects. Okay? And it also has unique effects on the regulating the inflammatory pathways, as well as improving resilience to stress and improving the mitochondria. So we can talk about each one of those, but I think we need to understand a little bit about our statement about the antioxidant effects, because it is a buzzword like we kind of talked about.
Yeah. And I also like that you said regulating the anti-inflammatory pathways, because that's the key word right there. Everybody's like, well, I want anti-inflammatory and I want antioxidants and everything. But I think you've had some really great points when I follow you on Instagram, obviously talk to you, and you really break down why it's all about a balance of these
Yes.
things in the right way. And I thought it was very interesting how molecular hydrogen can facilitate that in a balanced way where it's not overdoing and it's not underdoing. It's kind of helping these things find their happy
homeostasis.
medium.
There's a lot of different ways to try to get therapeutic levels of molecular hydrogen in your body. There's the gas, and you can inhale the gas. You typically want to do it for maybe an hour a day, and it's not as effective as drinking the water and taking it straight into your gut, which is where your immune system exists. But if you have, a particular problem like a lung disease, it may not be a bad idea to consider inhaling the molecular hydrogen. For most healthy people, or at least generally healthy people, the water can be up to 100 times more effective than the gas, and so it's the better way to go. There's also pills that you can take, and the pills actually use magnesium to create the molecular hydrogen water. Magnesium's not, it's actually good for you, but it has a taste, and most people don't like the taste. The other got you with the pills is they're expensive, and you really should be taking pills several times a day, and that's dollars a day for the rest of your life if you're going to take the pills. And every time you drink it, you're dealing with the taste of it, and you're only drinking a certain amount of water. Whereas with the molecular hydrogen water, the hydrogen rich water, you can drink as much of that as you can stand. And the nice thing about it is it tastes better because it's been alkalized, and so it makes it easy to develop a pour and drink habit that not only gives you the molecular hydrogen on a regular basis, but also hydrates your body. Bottom line, the K8 that I've owned for several years now, and that is out there in the marketplace with its 8 medical grade platinum coated plates to reliably produce molecular hydrogen, is by far the most proven, the most efficient, and the most reliable saturation level molecular hydrogen ERW system on the planet. So hydrogen helped kickstart our universe, right? It's the smallest element in the universe. It's also the most common element. Molecular hydrogen is simply 2 hydrogen atoms bonded together to form the smallest molecule in the universe. So I want to go back to the water now. Why am I calling it living water? It's because absorbing a therapeutic dose of molecular hydrogen before it escapes back into the atmosphere is really the trick to getting benefits out of molecular hydrogen. With the water, you generate the molecular hydrogen in the water. You pour it into a glass, and from the machine, you drink it, and the molecular hydrogen, if you drink it immediately, is still present and active in the water. An hour later, not so much. So you really want to pour and drink. That's the best reason in the world to call it living water. So Enagic, 50 years old, 3 million users worldwide. Not a water filter. It's a medical device used in Japanese hospitals, and very well proven, very well understood to have the value that it does. If you think about it, it's an invisible gas that's tasteless and odorless. How do you know you're actually getting therapeutic dose of molecular hydrogen? You've got to depend on the device that's producing it to actually deliver it to you over a period of time. Being the only company that retains complete control of the manufacturing process, they have a lot of ISO standards that they have earned, and from ISO 9001, which is just general quality management, that says I have consistent quality processes in my manufacturing. It actually even adheres to the medical device manufacturers' design, production, and distribution quality requirements for an ISO 13485, and it adheres to commitment to environmental responsibility in the ISO 14001. Most of the ERW systems out there don't have any ISO certifications. For Enagic, that's just the beginning. They've got all of these other Japanese certifications that you see because it's so widespread in Japan. That's where it was first made, and it's very widespread throughout that country. In fact, molecular hydrogen is everywhere in Japan. The beauty shops on the corner do molecular hydrogen treatments to help keep the skin younger and help keep younger athletes use it uh, for performance over there. In fact, almost any exercise club that you join over there, you'll find a water generating molecular hydrogen machine in that club. Um, the um, the fact is, though, that the Japanese are far ahead of us when it comes to the understanding of and the belief in molecular hydrogen. We are behind the health curve when it comes to that. As I said back in '67, they approved it as a medical device. Since then, they've put it in a number of hospitals and have been studying it and its effectiveness. They're even were using it for COVID and finding that it actually helped with COVID and the pain and the problems that COVID created in the human body, and they were getting cures for COVID out of it back during that pandemic. They, as I said, they're using it for anti-aging treatments, to combat fatigue, to improve skin health, to aid in athletic recovery, and it's also used in their ambulances now, even because and at least the stroke ambulances, because if you have a stroke and you feed somebody molecular hydrogen, you are actually increasing their chances of survival by, I believe it's about 40%. And so it's in all of the stroke ambulances in Japan. And so this master class was meant to be more informative than to try to sell you something. These are the two best systems on the market for producing molecular hydrogen reliably, and molecular hydrogen can change your life and change your health. And so if you're interested in picking up one of these devices, you can reach out to me. You can reach back out to the person that sent you here. And for the multi-pure, the first thing they're going to do is get a picture of your faucet to help you understand exactly what's needed to hook that up. And same with the Enagic unit, they will walk you through what you need to do to be sure that you're hooking these units up in the most effective way. You don't have to buy both units to start. The pre-filter, the multi-pure, is cheaper than the medical device, but they're both 50-year-old companies, and they're both very dependable systems that should work for decades for you. So even though there's a cost to it, there's a lot of financing options, especially with Enagic, that help people qualify even with zero down to get these machines into their lives. And Enagic's financing costs are absolutely minimal. If beyond that, so if you want to buy one, get a hold of me or get a hold of somebody and we'll get it to you. If you feel called to actually become involved in what most of the people that are selling these things consider to be a mission, because we know it's making people's lives better. And if you want to become involved in that, there's a lot of people making a lot of money. My daughter's mentor in the business is actually responsible for about 60% of the sales at Enagic, and she's involved directly with him on calls weekly, and that whole operation that they have to help people understand what to do to get these systems and similar health-oriented products in people's hands is I think it's probably, in my 50 years of sales, it is probably the most efficient blueprinted system that I've ever seen for helping people get started, because it's created by and run by the people who are the most successful, the ones who are making millionaires in that business regularly. It's a lot of fun. There's no pressure. You can go in and explore it as much as you want. Everything you learn is going to be interesting, and highly recommend that to anybody who is interested in helping get the word out about these products. About dealing with the quality of our water that we've got coming into our homes in such a way that you don't suffer from it. You actually get past that. You have clean water coming in that you can count on, and you then have a chance to bring living water into your house, into your body, into your family's health. So if minimally you want to know more, uh, go to my Facebook page. I'm posting on there regularly, facebook.com/Miracle Molecule Mentor. If you want to get a hold of me, I'm Miracle Molecule Mentor at gmail.com. Happy to hear from anybody with any questions anytime. I'm at the point in my life where most of what I want to do is just be helpful. And I think that I stay involved with this every day, most of the day, because it's the most useful thing going on out there. I write around my molecular hydrogen research now instead of the other way around.